So thank you everyone for joining us this morning and for coming to the United Changemakers United Summit. We're so excited to have this session right now. This session is called No One Left Behind for a Lack of Healthcare and Equipment. And we have some amazing social entrepreneurs that you can already see on our screen who will be talking about the COVID crisis and how the healthcare system has, the strain that has happened on the healthcare system and how they've looked to address it. So today we are discussing this and we want to explore some of the larger systems changing themes that have been brought to light because of this time of COVID and the impact on the global community. The pandemic has affected everyone in many ways, from financial to social to political. There's more than 4 million documented cases around the world, and this sudden, unexpected strain on the healthcare system has been really profound. In addition, individuals, families, and communities have had to navigate these uncertain times, and we've had to understand how to work in new social constraints and how this has influenced both our mental health, our emotional health, and our physical health. So that's why we have 4 really, really exciting social entrepreneurs joining us today. I'm going to introduce them one by one very, very quickly, and then we're going to have a really deep conversation with them. So Carmen Pellicer, founder of Fundación Trimela, is working on an app-based home care model for patients in isolation. Dorica Dan is the founder of the Romanian National Alliance for Rare Disease, and she will be talking about her platform of online therapy for patients. We have Christian Fiekert, who is the founder of My Mind, who has been addressing the mental health needs of individuals in isolation. And we have David Cuartieres, who is the founder of Coronavirus Makers, who is working with the global community to provide protective gear for medical professionals using 3D printing. We'll hear from all of these entrepreneurs soon. I promise I won't talk the entire time, but first some very, very quick housekeeping. So we absolutely want the participants to join in on this conversation. We want to hear questions from you. So my Ashoka colleague, Julia, will be connecting with you on the chat platform and identifying individuals who will ask questions. And then she'll invite you into the chat and we'll get to see your face and you'll get to ask the question directly to our panel. We have 1 hour, 57 minutes to be exact. So we'll do our best to stay on time and cover as much as possible. So I want to dive in right now and start actually with the problem. I spoke a little bit about it in the beginning of this, but I'd really like to hear the problem defined from the social entrepreneurs and the experts themselves. So I'm gonna direct my first question to Carmen. Spain has been one of the countries in Europe that has had actually the greatest demand on its healthcare systems due to the COVID-19 crisis. How would you describe the overall challenge that the healthcare systems have had to deal with?
Well, Spain has a very centralized health system in hospitals. So each area depends on one big hospital. So our primary care and home attendance is very poor. So we've had up to now about 230,000 people affected officially of the illness. 95% are over 60 years old. And about 18,000 people have died in home care residences. Why? Because hospitals couldn't attend at the beginning, everybody going there. And we don't have a very strong structure that actually helps patients to stay at home if they don't need to go to hospitals. So hospitals got very crowded very quickly. The intensive care units got overloaded. And we didn't respond enough in actually attending people where they were. So I think that's one of the challenges, that it was very strong at the beginning with us for a long time.
For the insight and that perspective. And you mentioned something really key about attending people where they were and the struggle with that. So I actually want to switch over to Christian and hearing what Carmen just shared with us, knowing that you're located in Ireland and you've been also working with the healthcare system, but from a mental health context. And I want to know if there's any similarities in the problem that you've seen in your geographical and your professional context that Carmen just talked about. And then what are some of the differences as well?
Sure. So in Ireland, we basically the lockdown happened from the end of March, and what we saw at the very start, and we as a service we had to switch very quickly to online services only, which we did. We did this within 4 days. So I remember the day when we had a video call with our mental professionals. We have over 120 of them. We did this call on St. Patrick's Day because we thought that would be the good moment, actually, because everybody was not working. So there was very good attendance, and we set up 7 days for the switch from face-to-face to online services, but actually the switch happened within 4 days. So that was very efficient switch. But what we saw in terms of the clients, the first 2 weeks were very slow in general, because that's where the mindset is for mental health and for counseling and psychotherapy in general, that the session should happen in the room, right, face to face, sitting on the chair, talking to person in the room, not really talking via video call or phone call. So this kind of shift had to happen, and it happened within the next 2 to 3 weeks. So we saw at the very start kind of drop in terms of clients using our service, but then significant increase. And for example, right now we see quite a lot of clients contacting us with anxiety issues, depression issues. So that's really the surge of clients presenting these particular issues, and we'll see even more post-COVID situation, not only in Ireland but also in the other countries.
Thank you for sharing. And I actually want to come back to this topic a little bit later in the discussion. But what, and to summarize what you've both said is that from the healthcare system, there was just kind of this onslaught and an inability to really respond to the needs that were there. And then from an individual standpoint, almost people kind of neglecting their mental health in the first couple of weeks, not realizing that actually that was probably something that was really necessary for them. And so now you've seen a spike go up. And so I want to move to the solutions, because I think all of you have had some really amazing responses to this. And we know that crisis kind of breeds creativity, and necessity is where human creativity kind of really comes into play. So I'm going to start with David. David, if you can talk a little bit about coronavirus makers in the community of over 20,000 change makers that you have, that are not traditional healthcare workers, that you have brought together to support the strain on the healthcare system due to COVID.
Well, first I would like to say that we got together more than I brought them together. I don't think that's fair. I think we all got together because Spain has a very interesting techno-social fabric that has been growing throughout the years since the late 80s. And this makes that there is a lot of people in Spain that have an interest in technology as their secondary activity. Either they work as technologists and then at home they use it as a hobby, or they work at whatever else and then at home they have it as a hobby, right? And so when the emergency started, people started to gather up in this Telegram, which is a social network channel, and discuss about how to build a ventilator, because the government announced that they anticipated there was going to be a lack of ventilators. So people started to discuss, let's make a ventilator, what do we need? But this discussion gathered over 5,000 people in less than 3 days. So of course, when 5,000 people try to make the same thing all together, there is a lot of overhead. And people started then to diversify, started to ask other questions. What else do you need? And somebody through their neighbor brought up, look, they don't have face shields, these plastic shields that protect you from flying particles. And they don't have goggles. They don't have enough masks. They don't have enough gloves. And so people started to analyze what are the things we can do very quickly. And the first response was face shields. And now our community has made over 850,000 of those and served them to hospitals and police and whatever. So I think that the interesting thing is to see how people can get organized if they have the tools. There's a lot of ifs in this, right? And then can start producing things. And then once things start to really work, then the whole system self-organizes again in building some sort of governance model that allows it to respond to needs as an entity. So we have built sort of an entity that can respond to these different things by building a lot of small things. So now we have over 20 different projects doing research and development in different machines that are needed. For example, now that we know that the disease is spreading through the blood and not necessarily directly to the lungs, people are building oximeters to measure the amount of oxygen in the blood and know when to act. We're building dialysis machines to help clean up the blood. And, of course, we have a big campaign right now on masks because it's the next thing in Spain. People need to wear masks. So we have designed different models that have been or are in the process of validation, because that's the other thing that people have been, or we have been doing, is that we have streamlined the whole process from idea, where we interact with somebody to figure out the concept, R&D, like mid to large scale manufacturing by people distributed, to then actually validation in the Ministry of Industry, and then eventually donating this to SMEs that will manufacture and bring this forward. So we've created like an R&D entity for a country trying to help out in a situation of crisis. And this is one of the most amazing things, I would say, like how people could self-organize and so on. But now we're like 10 weeks in this mess. And there's a lot of challenges that emerge when you have these situations,
Thank you.
We could talk about this for hours.
No, thank you for sharing that. And it's so interesting how you, first it's that, everyone wants to help at a time of crisis like this. And so how can we make that help most efficient and as efficient as possible? Dorica, you're also working with an online community through the work that you're doing, and you're supporting individuals with rare disease, those who are immunocompromised, and also working on some of the mental health challenges that are happening. Can you share a little bit more about your solution and how you've been addressing the COVID response in Romania?
We are working in a center called Neuro Center, which is a one-stop shop service approaching medical, social and educational services for people with rare diseases. And with coronavirus, we have to change all our services, to switch the services in online. So we were thinking how we could better support and ensure continuity of care for patients with rare disease in Romania. So on one hand, we are working in the center, and on the other hand, we are working with the National Alliance with all the patients with rare disease in Romania, with other organizations. So we tried also to coordinate the care and find the needs of the patients, applying questionnaires, but also trying to answer to their needs and support their home care. So we are preparing now a platform for children and young people which are using Neuro Center, and this platform will have online therapies where we could have online therapies when the patients can't come to the center, or if we don't have enough places in the center, we can patients than our center in the future. And also we will be able to provide with online consultation, online counseling services, and also organizing groups of patients, because in rare disease the disease are not known even by professionals. So we are currently organizing Neuro Center groups of patients with the same rare disease coming from all over the country for 1 week from Monday to Friday. And they stay in the center. We are providing them with therapists, but also with educational therapy. They meet with professionals and they learn from each other, creating support groups. So now we are moving these support groups in online on this online platform. And we also want to create, and we are working on it, to create a risk alert application for patients with rare disease that need emergency care. Because for the moment, some of them had to to quit their treatment, and because they were afraid of infections. So this risk alert will warn the emergency units that they are coming, and they will be oriented on different pathway in the hospital in order not to be infected. So this kind of support we are providing. We also help patients with different materials and guidelines. We are providing with integrated care guidelines for patients and care guidelines in time of COVID for different rare diseases. We also supported the community because we believe that we have to be useful in the community. So we supported them with equipment, protection equipment, with CPAPs for respiratory needs for some of the patients with rare diseases in case of infections, but also with DNA extractor, and our geneticist was training the other professionals in the city. So this is how we try to create and to ensure continuity of care for patients with rare disease in Romania.
So interesting. Thank you so much. And I didn't even think about the fact that just trying to access care, creating a system in which you are, creating a path that's least infected opportunities is something that you can do in order to support people with rare disease during this time. Carmen, you're also working on online therapies for patients. Can you tell us a little bit about the solution that you have brought into this crisis, or to address the crisis?
Okay, we have already been working on remote control of patients and self-care monitoring and empowering patients all about 40 different illnesses in the last 10 years. So we have a vast experience on it, and we have a very sophisticated platform that we have adapted for COVID-19 because the Portuguese government required us right at the beginning if we could actually do it and use that experience to create a protocol. So to understand it, imagine that you suddenly feel some temperature, or you know your relative has the COVID virus and you're frightened. Imagine that you had in your mobile just enough to control yourself every day for the 2 weeks, every symptom. And we have created this with the protocols of the OMS, of the World Health Organization, and with a team of doctors. So you can actually register all your symptoms, and then you get alarms if you need to have access to a nurse or to a doctor because you are getting to the risk level. But then imagine that those data actually go to your hospital, or to your PE, or to a nurse that actually controls those symptoms and knows that they have to contact you because you are under risk. And imagine that all that data that the hospital has can actually allow the hospital and then the local government to control how the illness is spreading. So really everything can be in your mobile. So we have actually created the app that can be unloaded free, and then we can help so many thousands of people to actually learn to self-care themselves, because we are not so worried about what's happening now in the next few weeks, but we expect the illness is going to be with us for at least 2 or 3 years. So really something that needs to save the hospitals the burden of having lots of people really frightened every time they contact the illness somehow. So we need to come, we need to learn to empower ourselves to be able to control the situation in a long time period.
Such an amazing innovation. And again, yeah, the key is how do we learn to empower ourselves, and how do we provide everyone with the tool to be able to access the care that they need, even in their own home, as long as they have, one of these with them. And so I'm going to turn to Christian, because I also believe, the work that you're doing with addressing mental health needs, you're already doing that, but you talked a little bit about the beginning, and a lot of the work that you're doing is also about helping people to empower themselves through this crisis.
Yes, exactly. So basically, when I set up the organization back in 2006, e-mental health or online component of mental health was always there, because since the day one, it was very important for me and for the mission of the organization to provide accessible mental health services. So then. The accessible, it means that needs to be really easy to access, especially to clients living in very remote places or rural parts of the country. So so that's why even before the COVID-19, we were the providing kind of blended service. Majority of our clients were using face-to-face service and smaller percentage of online service. But then, of course, through the COVID-19, we completely switched to online. And our platform that we developed a number of years ago is really allowing this to have a very secured connection, very easy and user-friendly connection with mental health professionals. So, for example, we're not using any third-party software. Everything is happening through the web browser, so we're not even asking our clients to download any software to install on the computers. So that's why we created this high level of trust towards the technology. And on top of this, every client has full access to their own data, so they can see clearly the progress, how they're progressing with each mental health professional, and what can be done even further. So there is a certain level of communication between the client and mental health professional between sessions. So in general, what we see now is really increase of clients using video calls, sometimes phone calls, so phone counseling sessions if they, let's say, have very bad internet connection or they have no access to internet at all. So we still are able to provide the service for those clients. And definitely what was very important in the past number of weeks was this shift that happened and is happening in wider society, that people are more open towards technology and they trust more technology, of course, if the technology is secured enough. But yet that's what is really helping to helping us to help clients because they are more open to really connect with mental health professionals and request and ask for mental health support. So that's great that this particular shift is happening. And even when we did the kind of projections post COVID-19, we estimate currently that we won't ever come back to the same kind of percentage of lower percentage of online sessions. We think that this will stay relatively quite high. And of course, some of the clients will come back to the face-to-face service, but it will be a relatively smaller percentage than it was before. Yeah.
Interesting. Thank you so much for sharing that. And really, across the board, amazing solutions. When you talked about building trust with the technology, I think that's something that we take for granted when we're dealing with such sensitive topics. But that trust with the technology is really needed in order to be able to provide the healthcare access. So many amazing solutions. Please, everyone who's watching, check out the expo. Not now, finish the session with us first, but do check out the expo to learn more and also to understand the needs of these social entrepreneurs. I know there are tons of burning questions. I can see my chat screen scrolling up. And so I'm going to invite my colleague Julia in to take some questions from the participants. Julia?
Hello, do you see me and hear me well? Great.
Yeah.
So I would like to invite, thank you everyone for bringing your questions in the chat. Some have already been answered by the social entrepreneurs themselves. I would like to invite Kate Holliday. So if you can accept the invitation, I think you should be in the panel soon to ask your question. And it's a question to all panelists. So let's see who wants to reply. Kate, yes, you're in. Welcome.
Hi, everyone. Thanks so much for your presentations and congratulations, and thanks for all you're doing for people out there. So tiny bit of background, our organisations in Switzerland, UK and Australia, but what my question comes from the context of an Australian program where we're placing nurses in grassroots patient organisations so that we know that's where patients go for a lot of their information. So if they're met with a health professional, they do a lot better. But what we're finding in COVID, obviously a lot of the focus from governments has been on the response, the immediate threat, which we understand. And like a lot of you said, that chronic care is being left behind. So what we're seeing is a lot of patients regressing, particularly chronic conditions, a lot of fear for immunosuppressed patients that are just scared to go out, even with some isolation easing in different countries. So I was just wondering, across the board, is that what other countries are seeing? Is this, I guess, a lack of focus on continuity of care of patients not being able to access their routine health system services? And we're also a little concerned about the fallout, which I know a few of you have mentioned as well.
Thank you.
Okay.
Oh, yeah, Carmen, please.
If I can answer, because it goes with what I was saying before, I think it's a huge challenge as a culture, a change of culture, really. We need to empower patients to be able to be the owners of their own illnesses, not just with the COVID, but whatever it comes in the future. I mean, if you think in Spain, 70% of the people who have died were in home care, in elderly care. That is more than 18,000 elders that have died in homes. And why? Because wasn't any doctor. I mean, the big breakthrough between the actual medical staff, which is insufficient, and it will be insufficient for years, and the rest of people is impossible. So we need to create two things. I think we need to create middle staff, like auxiliaries or people who are in charge of homes or people who care for elderly and their own homes. They need to have the sufficient training to actually deal with symptoms and be able to do a sort of pre-diagnosis to who needs care and who doesn't. And then we really need to invest as societies in empower everybody of us to actually be owners of health, conscience and protocols, and how to care about ourselves and when to decide to go to hospital and when to decide to self-care at home. So I think technology is going to help us, but we need to develop trust on medical technology. Because for many of us, you just cannot trust that a mobile phone is going to actually give you the right answer. So there is a challenge for media as well to respond to that.
If I could just sneak in a follow-up question. Do you on the panel, do you see the work that you're doing is needed, it's filling needs? Do you feel like your governments are seeing what you're doing as fragmentation or as part of the system?
Well, we work with a lot of partners, and I didn't mention in my short presentation, but we are just about to launch a very big campaign with the government that is mental health campaign. So we'll be providing 15,000 at the start, 15,000 free of charge counseling sessions, video sessions to the public and people really affected by COVID-19. But beside this, we work with a lot of partners, and we are really hoping that through this particular crisis, these partnerships are going to be even stronger and stronger in the future, because it's very, very important that we really work together and that there is less and less fragmentation. And that's definitely what is happening in various different sectors, that this specific fragmentation happens, especially if there is a, let's say, certain solution for a region or small town or a city, which is great, but then it's not really sustainable. So we need to think about how we can sustain good solutions, or how can we integrate good solutions with kind of mainstream delivery. So that's going to be kind of our next step as an organization as well, to share our technology with some of other organizations. We will be asking them to join us, just to create kind of bigger movement in the country, not only in Ireland but also in other European countries and other countries around the world. Yeah.
Thank you so much, Kate.
Thanks.
Julia, do we have someone else?
Great, Jeleka, do we have? Yes, we do. So I'm inviting Richard Holloway to the screen. Richard, you should be able to join. If not, please refresh your page real quick. Okay, then maybe, yes, we take it to the next round, Jeleka, so I would suggest you move forward, and then we come back next question.
Yeah, so let's move on, and hopefully we can get Richard back with us. And thank you, Christian and Carmen, for taking on those questions. I want to move into the change that we want to see. We have kind of been forced into change, and you know, this historically change doesn't, there is a trigger often that needs us to force to change. And so this is one of those triggers, and I think it's a trigger that globally we all understand is needed. And so this is an open question to the panel. If you could change one thing in your country right now in order to better address both the challenges that we have around the COVID crisis right now and the ones that you see coming into the future, what would it be and why? And I'm going to popcorn over to David and see if he wants to take on this question.
Okay. I mean, how to answer this without sounding very political or politically incorrect, right? So you dropped the bomb on my desk. Anyway, so I would say that I'm starting from the perspective that nobody knew how to deal with things. I think countries did have information. A lot of information is publicly available, so you can check records, but they didn't know how to respond. Also because we didn't know even which were the mechanisms on how the disease spreads throughout the body. But for me, the biggest challenge has been that there were no mechanisms, for example, for changing how the medical system responds in state of alarm. There is a lot of challenges that emerge from this. For example, we need to design new ventilators. The normal process to approve a ventilator takes 2 years. Now we need to make it in 15 days. How do we redesign this? You know, so those are challenges. Or automatically corporations jump in, and in order to avoid people misusing the resources or scamming other people, they forbid anything that has to do with COVID-19. And I know, for example, that Carmen has had this challenge as well. So you want to register an app to help people out, you need to make, you know, a lot of bureaucracy, not just in your country, but also with, I don't know, Google Play for your app to be approved, you know? So it's like, this is amazing. In Coronavirus Makers, Twitter banned any link to our forum. When we were at the peak of people demanding information, because the first 2 weeks were insane. People were demanding information. We had 200 gigabytes of data flow in our servers because people were suffering anxiety attacks, and they wanted to get reliable news. And then the normal response from all of these corporations and the public sector was, let's close anything that has to do with this. And we were there trying to like help out. And it wasn't just good intentions, because, you know, everybody in this room, they are professionals in their field. So in Coronavirus Makers, we have doctors, we have PhDs in physics, we have everything, right? So our opinions were pretty knowledgeable. So I think the first thing is that since there is no experience in contemporary times on how to have a civic response, I think we need to implement those mechanisms in the public sector. And I know at the European level, there's already a conversation about that, but I would like to see how this evolves.
For that answer, and sorry for dropping the bomb on your table, but I think what I really pulled out of that is how do we bring in some of this agility that we've been forced to have into our regular days, and so that it doesn't take 2 years to have something that we need now approved, but that we can bring this 15-day process that gives us the same product at the end more into our everyday lives. Dorica, I'd also love to hear from you in terms of the change that you would request right now, either at a country level or at a global level, that stays as a result of what we've been dealing with.
So I think if I could change something, I would create and adopt a policy for a standardized IT tools that can help health tools, digital tools that could be integrated into the National Program for Health in order to connect with the resources, in order to inform better patients, in order to communicate better and to choose which is the right information, to train professionals and population about how to behave, to send alerts to emergency units about different needs of the patients, or to monitor patients from distance, to coordinate the care of the patients, and to provide online consultations, therapies, and counseling, and of course to create equipments and to connect with the proper resources. So I think we should standardize the IT tools for health and create and adopt a policy for e-health in Romania. This is what I've done. I would do because our infrastructure for healthcare is not enough and is not enough developed, and we should relate on this kind of tools that prove that they are beneficial for the patients and for the people in these times.
Thank you for that. I'm going to go off on a tangent a little bit in a question that is continuously coming up around the mental health, anxiety, and the challenges that people have been having. And there was a recent comment from the World Health Organization about this kind of continued mental health issues that will happen now that in some countries that are opening up, but knowing that the virus is still there, the anxiety, the increased levels. And so this is a shift or a change that the world at a global level is going to have to deal with. And I would love to hear from Christian in terms of his feeling around that.
Yeah, so definitely we will see a huge surge of mental health difficulties, and people actively seeking for mental health support. So as you pointed out, WHO's were kind of stating that 25% of the population in each country would suffer from mental health difficulties at some stage in their life, where actually the research values, other research around Europe, for example, is stating that is even 10% of the population every single year. So that's huge number, yeah, and that was before COVID-19. So when we look at the kind of country level in each European country, of this 10%, only 15% can access public mental health services. So that's very small number. And another 15% is going to the private counseling and psychotherapy services if they can afford. So that's leaves 70% of the 10% without any particular access. Again, I'm just trying to say here that this huge number, yeah, and that's everything before the COVID-19. Post-COVID-19, the estimation is that this 10% can even increase to 20% very easily, or even exceed 20%. So we will see huge surge of mental health difficulties across communities, across countries, and there will be definitely need for very quick response in very timely manner. Because even from our experience, we see that if someone is coming with for an online session now with mild anxiety issues, it can we can help this person within, let's say, 4 to 5 sessions. Yeah, on average, because that's where our target is. We targeting clients with mild to moderate mental health difficulties. But even the change between mild difficulty and moderate is so significant, because just to give you an example, if someone is suffering from mild difficulties, on average is let's say 6 to 7 counseling sessions, but for moderate mental health difficulties, this number increase rapidly to 15 or even 20 sessions that are needed to really rebuild all the coping skills for the clients. So that's the level that we will be facing, and it's extremely important that clients would have very easy, quick access to mental health professions in coming number of months, number of years, I would say.
Thank you. Easy, quick access. I want to turn it back over to my colleague, Julia. I know that there's more people and more questions for all of you. So Julia.
Yes, hello. So I just invited Richard Holloway, who managed to join. So please, Richard, you feel free to ask your question.
Hi, good morning. Very interesting indeed, Christiane, to hear about what you're doing in Ireland. My question originally was, what kind of methodologies are your mental health professionals using in Ireland? I'm aware that there are a variety of different methodologies, and I don't know Ireland well enough to know whether there is a standard method in Ireland or not. But having asked you which methodologies, and I gave you the opportunities of TFCBT or EMDR, but having asked you about what methodologies are being used, I wanted to ask if there's any feedback yet from your mental health professionals about which ones work, and whether this system of working through video conferencing, or whether this system of working through digital connection, what is their opinion as mental health professionals? Does it work?
Yeah, thank you very much, Richard. That's very good question. So we monitor basically how the clients are engaged with the therapy process. So every single session we ask the question about the engagement and how is the progress through the therapy. So when we kind of compare, and of course at the moment we still have limited data because the full switch to online happened just let's say six weeks ago. So we're still collecting the data, but so far we don't see huge difference between face-to-face service and an online service. So of course, our mental professionals, they had to adapt as well in terms of how they conduct sessions and what type of approach they're using. Most of them, they have various trainings in place, so they are not specifically focusing in one particular approach, like you mentioned, CBT or EMDR. They might be using different approaches. From the research that we've done before even COVID-19, we see that definitely CBT is working very well with online sessions. Maybe psychoanalytic approach not necessarily, because it's very long and in-depth kind of process. So definitely some of the therapists, they had to adapt. That's for sure. We also using impact measure to really see if there is a positive change in terms of the client well-being. And for this particular purpose, we're using Short-Vavrick Edinburgh Mental Wellbeing Scale. So we measure how the client is, where the client is when they start the process, and when they are in the middle of the process and at the end. Yeah. hopefully I answered your question.
We could talk for a long time, but thank you. That's a good answer.
Yeah.
Thank you. And just wanted to give a reminder to the participants to please write your questions in the chat. In case you don't see the chat because it's hidden, you should have a small arrow at the top of the screen. And so let's give it maybe a couple of seconds if anyone has a question and would like to join in the conversation. I know Corina was here, but I don't see her now. So Corina, in case you're still here with your question, please ask to join again. If not, Jeleka, over to you and we can continue.
So Karina, please do ask to join again. I am interested in hearing your question. We're going to stay on this kind of topic of the change, because I think what we are all really realizing is that, Ericles, the big debate is, can we go back to normal? Is that a possibility? And if we can, how long is that? But do we want to? Do we want to go back to normal? And what is the actual new systems that need to be able to better address, and hopefully this doesn't happen again, but likelihoods that a global pandemic can happen again, or something at this scale can happen again. How can we learn from this to do better in the next time? And how can we learn from this to do better when normal returns? And so my question to the panel, again, in an open way, is what are the systems that need to change? David touched a little bit on the political pieces. What are some of the other systems that need to change so that our new normal is better equipped to deal with what we're dealing with?
If I can maybe, sorry, yeah, no.
Okay.
Go ahead, Karen.
Now I was just going to say, we all talk about going back to the new normal, and I like to say we have to go back to a better normal. So we don't want to repeat the same mistakes. I think the situation has made us to appreciate and value our health workers, and we clap them every day, I think practically in every country. But I think as well that it has helped the health workers to realize that mature societies would make the situation much better. So I go back to the idea of we have to empower the patients. We have to decentralize the medical systems. So we empower local and home care. So we don't need to overstress the specialized, very specialized medical class. And that means not just political decisions on how we distribute resources in empowering the primary assistance. We need as well to invest very much on the cross holistic measures that a society needs to grow and mature and empower, like education. We need to put health in the center of education in a very systemic and effective way, and make sure children, since they are very young, learn themselves what the importance of a holistic view of health, and that we make them responsible of themselves. And that is going to be happening in schools, in universities, but it's got to be happening in gyms, in the parks, in the clubs. So we need that as a society, health related to physical well-being, but as well emotional and happy well-being, is at the center of our aim as a society. So that means a real joining and very generous effort to think about a better normality to go back in the future.
I really like that. I'm going to start using better normal instead of new normal. Christian, you also had a comment.
Yeah, no, I like very much this word better normal, because then it is more positive, right? And what we're trying to communicate, and I see that is even the health services in Ireland are communicating this as well, that yeah, that's going to be new but better normal. So that's what is really happening, and what is needed. And just going forward, we need to keep in mind as well that And that's kind of the message that I was always sending to the governments. Better and bigger investments into kind of technology and innovation that is needed, and especially in our social enterprise sector, NGO sector, where we never had enough resources to innovate and to develop certain ideas and technology. So hopefully this will bring some more positive changes to various different sectors, not only healthcare, but as Carmen mentioned, education and some other sectors. Yeah.
And I see Dorica is back with us. Good.
Yeah.
I'm glad. What is your better normal, Dorica?
I think we should all learn that we have to shape our policies according to the scientific evidence in order to save lives. And also we should treat the healthcare system differently. So we shouldn't look at the healthcare system in terms of cost, but we have to treat it as a public global good for the entire population. We have to take into consideration that healthcare is for all. And maybe we should think more about universal health coverage, not like a tease, but to implement it. So that's my...
Thank you. And David, I'm going to throw this to you as well. The better normal, and knowing that you've also been just able to engage communities outside of healthcare.
Mm-hmm. Yeah, I was going to say that, in my opinion, one of the most beautiful things that have happened in the last months has been the crazy collaboration between people coming from all over the place. I mean, despite the fact that there are terrible circumstances, there are terrible things happening, people are suffering left and right. There's a lot of suffering that's going to happen to people that we know, eventually to ourselves. I think people are bringing the best of themselves. You know, it's like we had to transport a person from the Canary Islands to Oviedo to make a test in a clinical trial because he's part of a project. We got the army to fly this person. You know, this is the level of collaboration we could get to happen. We had to distribute face shields among medical professionals. The police would pick them up from the guys making them at home and bringing them to the hospital. So, of course, this couldn't last forever, and that's why Coronavirus Makers comes here to ask for help. But when we needed help in the most critical moments, everybody were, helping out. Another question is for how long can we spread this solidarity over time? Because there's still a lot of months ahead of us where we still need to make the best we can to make a better society, or a society as good as possible for the months to come.
Thank you for sharing all of that. Julia, I'd love to bring in one more question from the participants. So I see we have someone. Can you join us?
Yes, hi. To come. So I'm inviting to the panel Margarita, who just joined us, to ask her question to the panelists.
Hello, thank you all for everything. It's been a wonderful conversation. So basically, it's a bit of a tricky question because I know that a lot of you are working very locally on these specific solutions, but obviously you want to scale up and be able to go into other territories. And actually, through another Ashoka Fellow solution, the Bridge for Billions, I have been mentoring a girl who participates in the program, who is trying to kind of create a solution that supports access to healthcare in Kenya. And we have really been struggling a lot because, there's so many kind of challenges. It's not just the fact that, a lot of health over there is restricted to people who can afford it, but also there is a lot, the mindset also needs to be changed. A lot of the people prefer to spend the few dollars they get every day through their informal work to more, essential items. And then obviously they find themselves in really bad situations at some point. And now obviously the situation with COVID has accentuated problems because people have had to be treated, and then chasing them to pay for the treatment when they actually, they're not covered. So I don't know, are any of the solutions, like I was thinking especially your work, Dorica and Carmen, like, in terms of like, something that is a bit more proactive and helps empower them in some ways, so that they can, like, they can take charge of some of their conditions?
Yes, if I may answer, we, in the normal times, when we organize the group of patients at the center, we also organize meetings with the patients, conferences and webinars, workshops, where we train patients on patient empowerment. And also we train them on advocacy, how to sustain their rights, and how to work with centers of expertise, for instance, for patients with rare diseases. We are also connected with EURORDIS, European Organization for Rare Disease, where patients are participating in different training courses for patient empowerment, patients as experts, and they are recognized in the field of rare disease in their cooperation with professionals and also at international level. So we are training patients to be more resilient, but also to defend for their rights and to advocate for their rights. Yes, we do this. Thank you.
And I'd like to add that we've been working in Africa for quite a few years now in educational programs. In Guinea Equatorial and in Cameroon, basically. And my experience there is that everybody has a mobile phone. I mean, they may not have anything else, but there is a mobile phone. So, and there is a lack of professionals. So what we are trying to do is adapt this so vastly that everybody could have it. And we could actually design, and that's one of the things I'm asking for support, is to get a basic training where local leaders, like even teachers sometimes, can actually handle the information, the basic information, so everybody can actually care themselves. So it's not that difficult. We cannot sort out everything, but we can adapt all this to situations where there is a lack of resources, and for a long time that's going to be the situation. And I think it's quite urgent.
Thank you, Dorica, and thank you, Carmen, for taking on that question, and Margarita for a really great question. We are so close to time, and actually, Carmen did a really great thing in preempting my next question, which is, what do you need? What is the call to action? You have talked about these amazing solutions that you have done in these very resource-constrained situations and times and high anxiety. And imagine how much more you could do with the support of the community that we have on the call today. So I'm going to do a round. I'm going to go in the direction that I see on my screen. So starting with Christian, what is your call to action? What does my mind need?
So basically, if you want to join our movement of accessible and affordable mental health services, just please contact us, send us an email, and we can take it from there.
Thank you. Carmen.
We basically need not very big financial support to translate the app to English at least, and then to develop some of the aspects that could be needed to be really, really huge. And then communication. Any support to actually expand the use of the app that can be already uploaded from Apple and Google. That'd be great.
Thank you. Dorica.
So I think we all want a safe tomorrow. So I would like to invite you to support the cause of patients with rare disease in order to nobody to be left behind. So please contact us, and we can share with you what we do, and you can support us, because we are living together and learning together. Thank you.
Thank you. And David.
Yeah, well, we have two requests. One is about people with experience in organizing social movements. We are a social movement. We are working in building an NGO, but we are a lot of people to start with. Over 15,000 people. So anybody with experience in communicating in these kind of large groups would be more than welcome. So pro bono help, welcome. And of course, financial support to support the other development, manufacturing, serving, and so on is also needed.
Thank you so much. Unfortunately, we're at time. This flew by for me. I have more questions. I'm sure our panelists have more questions, our audience has more questions, but I really, really want to thank our inspiring panel for joining us today, for sharing, for educating, and for helping us to envision what the better normal is. I want to thank Julia, my colleague, who supported the audience and brought in some audience questions. So thank you so much for that technical support. I want to thank everyone that asked a question today and has continued questions to ask. Check out the expo. It is on the panel. It's close to the bottom. You will learn more about each of these innovations that we discussed today. You'll have a chance to share, to support, and to reach out to any one of our panelists. Please check out our expo. We are asking that everyone move to the main stage for the final keynote with our Nobel Prize laureate and the Ashoka Fellow, and that will start at 12:15. So on your way there, check out the expos, look out for more information, and thank you so much, everybody, for joining us, and thank you, panelists. It was very, very inspiring, and I can't wait to hear more about the work that you're going to be doing tomorrow, in the next month, and the next years to come.
That's great. Thank you very much. Thank you.
Thank you.